And we're starting. Ladies and gentlemen, welcome to another episode of Kareem Talks. Of course, I'm the host. Um, in light of the recent events, I'm going to take a more serious tone. Normally I'm very lighthearted, with the whole it's Sunday, March 29th, such and such, make a joke here. But we're not here for that. But in light of the current time that we're living in, um we're just going to get right into it. For those of you who don't know, we will be discussing the coronavirus in and of itself, who is targeted the most, what are the symptoms, how can you contract it, preventative measures, and of course how to help those less fortunate in dealing with it. Now, the thing is, this is all being recorded from Zoom, and because this is a free account, we're going to do a 40-minute session, and then I'm going to send another invitation, and that will be the question and answers, because I had some people send me their question and answers as to how to deal with this situation. I only got 2 questions, but they're loaded, so we'll use the next 20 minutes for that. But we're gonna start with what is COVID-19, the coronavirus? I'm gonna open the floor up to sisters first, and Brother Jabril, if you wanna.
No, doctors first.
Hey, that worked.
Doctors first.
So, Brother
Dr.
Jabril.
Jabril, can you
Yes,
can you
sir.
tell us can you tell us what you do like as a doctor?
Yes, so I am a human molecular geneticist. I study prostate cancer and breast cancer etiology and development in African American men and African Americans in general, as far as breast cancer. A lot of my previous work dealt with mitochondrial genetic analysis and how we can utilize that genome to assess clonality as far as cancer progression in women. We've done that type of study in mice first. However, my dissertation work was actually in prostate cancer innate immunity response work. So as a human molecular geneticist, I pretty much dive into specialties of prostate and breast cancer.
Okay.
Praise be to Allah.
Okay. All right. So, from my knowledge, I'm not Dr. Jabril. I am a pre-medical student, and I actually study breast cancer and prostate cancer disparities, where I do research with a lab here in the University of Illinois, Chicago. So my focus is more epidemiology based, which is the study of diseases and their movement, whereas Dr. Jabril is more clinical or scientifically based. So our knowledge is probably a little bit different, more extensive in one area and less extensive in another.
Mm-hmm.
But in terms of the coronavirus, so the coronavirus was found in Wuhan, China, the Wuhan district of China. And novel is the novel coronavirus. So novel is a word that means new. And it spreads from person to person through respiratory droplets. So the reason why we've been given these orders of social distancing and everyone's trapped in their homes is essentially because we always are giving off respiratory droplets. Even currently, as I'm speaking to you, I am letting out my own respiratory physical droplets of sputum and spit and whatever. And I know that sounds disgusting, but it's
That's
happening.
real. That's real.
So the purpose of the separation, which you got to dive into the teachings, but the purpose of separation is essentially is a protection for us and to keep us
Protection
from
and prevention.
spreading disease.
Mm-hmm.
Exactly. So that's what I have, my understanding. Dr. Jabril, do you have anything different?
Not different at all. To add to it, first of all, let me just ask what was the question? Let's dive into the question again.
The
Let's
question
reiterate.
is, what is COVID-19, the coronavirus, in its entirety? Sister Tynetta
And
did say it's a new, like, I'm hearing it's a new strain, because I
Mm-hmm.
did prior research to this episode and I heard there was more than one, an
Mm-hmm.
alpha and a beta and
Mm-hmm.
all this other stuff.
Yep. Yep.
So yeah, host does his research before, I don't want to come with absolutely nothing, but I'm
yeah,
here to learn.
Mm-hmm.
And what I want is for the viewers and the listeners who just listen to the audio podcast, to get as much information as possible, because I know there's a lot of misinformation being spread and conspiracy theories and whatnot. We're not here for that. We're just here, make sure people know what it is, how you catch it, how to prevent yourself from catching it, and the best way to deal with it should, God forbid, you do catch it, and help
right,
those less unfortunate who are suffering from
right.
it. That's
So
the goal and purpose.
right. So the first question, as far as what is it in its entirety, that's a
Mm-hmm.
loaded question. Let's start off by saying that number one, what most people are unfamiliar with is, first of all, the coronavirus isn't new, as far
Right.
as
Mm-hmm. Yep.
it's been around for decades.
Yep.
Um, However, the reason we call it novel is because just as we as human beings lived and evolved with viruses, they have a tendency to mutate.
Mm-hmm.
So, in viruses mutating, this novel coronavirus obviously has a mutated, enhanced capacity versus that which we were familiar with decades ago.
Mm-hmm.
Um, as far as how that came to be, we could dive into that later on.
Mm-hmm.
But what we know at the moment is that this is a strand that has been newly mutated. Let's just say for natural, from a natural origin. Let's just keep that for
In the back of our minds.
the back of our minds for the moment, and say that because of it being new, as far as this genetic enhancement, we are suffering from
Uh, you kind of going in and out.
to contact. Sister Tana stated.
Might be
Can
my
you hear me?
might be my connection. I can hear you. I'm checking my own connection. It seems to be fine. You can continue.
Okay. So contact, the saliva particulates that we spit out, or that we drop on a daily day basis, whether talking or coughing, sneezing,
Or just breathing.
just breathing. This has been known to be the up-to-date means of transmission.
Mm-hmm.
Um, there's a lot to be said about the coronavirus, quite
Mm-hmm.
different than what most people are familiar with, and
Mm-hmm.
that is, a lot of people may think that the common cold, right? They think that the common cold is primarily the rhinovirus, right? So here's
Right.
some facts for you, right? So 40% of what we would call the common cold case, right, comes from the rhinovirus. 20% comes from parainfluenza, but believe it or not, 20% of the common cold comes from the coronavirus.
Wow. Huh.
So this has been around for ages, right? However, our immune systems have dealt with the pathogen for quite some time, and we have become immune to previous strands.
Yep. SARS
Not,
and MERS.
right, not the newly mutated or genetically enhanced strand.
Mm-hmm.
With that being said,
Mm-hmm.
is the reason your question is loaded is because we are still collecting data at this moment as
Wow.
far as new symptoms to look after, modes of transmission, how long it can stay airborne, whether 30 minutes to 3 hours, how long it can survive on surfaces.
Mm-hmm.
There's a lot of data to be collected, even from an epidemiological standpoint.
Wow.
We're still collecting data on the curve.
Mm-hmm.
We're still collecting data on the curve as far as the assumed incident rates, the mortality rates to be predicted. everything is being collected on an hourly basis, right? So your question being loaded has to be dealt with from what we previously know and to take into account what we are gaining on a daily, on an hourly
Because
basis.
this information, what I'm hearing is it's constant. Like everything is constantly fresh, and things are constantly changing. For example,
Yes.
you had mentioned modes of transmission on how to collect it. What we know now, it's just from now. It's been like through what Sister Tynetta mentioned, why we have the social distancing because of all the respiratory ways we can get it. But something new comes up now, that data has to be added. So by the time this episode is done, more information is probably going to come out about it.
Yes.
Yes.
Okay.
Yes.
Mm.
So if you actually can go on the World Health Organization, their website, and you can see the day-to-day statistical report associated with the epidemiological aspects of coronavirus currently. So you can see where people are getting coronavirus the most. You can see a breakdown or an attempt at a breakdown by men versus women, in addition to ages. So to give some specificality, here in Chicago, we just had an infant die of the coronavirus.
I heard.
So a disease that is initially thought to affect just people who are elderly and immunocompromised is now affecting younger people and people who are seemingly healthy. So how is this? What are the strands that they are contracting that is putting them in the position that they are seemingly healthy and have been healthy, and now they are passing away from the coronavirus? So yeah, answering that question is very loaded, because at this current time, medical professionals really can't answer the question
because
there's so
it's
much
not
data.
fully concrete.
Yes, there's so much data that still has to be sifted through. So and this is to anybody who is out there saying what it actually saying, oh, I know what it is. If someone says they know what it is, then I would implore them to go do more research, because if someone who's trained for as many years as Dr. Jabril has is telling you, hey, that's loaded. We're still trying to figure that out.
That's real.
Then how can you, with not nearly as much training, of course, Honorable Elijah Muhammad, he did not go to college, and he didn't even go to middle school, but he could teach us. That's a man guided by Allah. So
that's period. That's on period.
That's period. That's on period. So it's definitely pertinent for us to keep in mind that questions like this right now are questions that people can still have.
But it's in its infant stage because you don't have absolutely everything.
Right.
Exactly.
And it's very so what I can tell you, what we can touch on is at least we know the biological effect that it has on the body, right? So when we ask, what is it? It's an upper respiratory infection that actually can become a lower respiratory infection depending on how severe the symptoms become. So this is where we start getting into the spectrum of symptoms that we see, right? So what we've heard thus far, and the reason why they say 80% of the population more than likely will recover from it, right? This comes from the idea that in the
it's like the common cold, and you have a strong immune system.
Right. So if you have a intact, optimal, functional immune system, what happens is that our body would treat the virus when we come in contact with it as strictly an upper respiratory infection. Strictly. So that means everything from the chest on up, right? So the symptoms that you'll see, you'll hear the coughing, the dry cough, depending, right? You'll hear the sniffling, the most recent symptom, which is pretty interesting, the total ablation of smell, and taste, right?
Mm.
That was something seemingly new, right? Because when it first came out, we did not talk about that being a symptom. We talked about the fever, we talked about the coughing, and we talked about those were really the two primary symptoms, right? But now,
like normal flu, basically.
right, so now that new symptoms are coming out, the ablation of taste and smell is
Meaning, when you say ablation of taste, you mean like complete removal? I can't smell
right.
anything. I
So
can't taste
apparently,
anything.
right. So apparently, those that have been affected recently, one of the things they complain most about is the fact that they can't smell or taste anything.
Mm.
So, with that being said, as I said before, data is being collected and symptoms are being updated as far as what we know of it. Okay. So, again, this is strictly upper respiratory, right? At this point, we're talking
Mm-hmm.
upper respiratory, sinuses, we're talking about nasal, we're talking about the taste, we're talking about the cough, mucus, all of that, right?
Mm-hmm.
And the assumption is that in an intact immune system, the upper respiratory infection will clear. However, when you talk about someone that is immune compromised, then what happens is that in addition to the upper respiratory infection, it then travels into the bronchioles, it then travels into the lungs, and then it becomes a lower respiratory infection. Then you're starting to deal with what we would call severe acute respiratory syndrome, which is SARS, and or acute respiratory syndrome disease, ARDS, right? So that is what we're most concerned about, right? We're concerned that if an individual allow the virus to travel into the lower respiratory tract, then at that point you're talking about an individual that can't breathe, right? Have issues then with their congestion in the chest, pressure, right?
Wow.
And then that leads into what we would call inflammation that builds up in the bronchial lobules, right? And then that brings into pneumonia. Pneumonia then becomes the absolute number one killer of those that suffer from the viral infection. So when they make this statement that you have underlying complications, these underlying complications normally come from an individual that has, let's say, hypertension, diabetes, anything that ranges from leukemia, cancer, whatever the case is. If you have any underlying complications that will cause the virus to that for it to start off upper respiratory and then travel to a lower respiratory situation, you're pretty much going to end up in a situation where you need ICU. You need a ventilator, right? You need assistance in breathing, because once pneumonia kick in and the fluid fills the lungs, you can't breathe on your own. So the idea is that we're saying for those that have immune or have a good immunity response, you should strictly have a upper respiratory infection that should clear. They consider it a bad flu, stay home, whatever the case is. However, what most people don't understand and they don't realize is that the American population isn't as healthy as you would say, as you think.
Oh, they most certainly are not healthy.
Right. So a lot of us have underlying complications that even as a 30, 40-year-old, you could definitely end up in ICU just as much as an elderly individual. So, we looked at the press conference today and we had Dr. Fauci talk about, he stands by the idea that we're going to reach 100,000 deaths. Well, I can believe this.
Did you say 100,000?
Yeah.
We're at 2,000, almost 3,000 now.
Yes.
We went to 2,000 in a matter of 2 days.
Right.
So we were at 1,000 about 2 or 3 days ago, and now we are at 2,000 and approaching 3,000.
Right. And we're behind the curve when it comes to Italy. So if you look at what Italy has suffered through, we're traveling on the same course, but we're slightly behind them. Slightly. So the projection is that based on Italy, how their mortality rate and their incident rate as it's increasing or whatever the case is, we're following suit right behind them. That's how the models or projection models are being taken into interpretation, right? So the point is that for those to believe that elderly are the only ones that are susceptible to death because of the upper that leads into a lower respiratory infection that then becomes pertinent for ICU and ventilators and things, you have to think again. And that's why, social distancing and staying at home is then important, because you have to keep in mind that a lot of so I don't know if you've looked at the data recently too, as far as who's actually filling up the hospital, right?
It's young
So
people.
just as
That
much
I
as
haven't. I've
right,
only
so
been
just
hearing
as
about
much
the
as
mortality rate.
right, so just as much as individuals say that the elderly are dying, believe
It's
it or
the
not,
young
most of the
people.
hospitals, they're filled with 30 to 40-year-olds.
Yep, 30 and 40, and sometimes 20-year-olds.
Yeah,
Yes.
yeah. So,
Yes.
I hear those that say that it's similar to, the flu, but yet because data is still being collected, it's very difficult to make the comparison to something that we've lived with for well over hundreds and hundreds of years.
Mhm.
We're still within the year. We haven't even reached a year of being with the novel virus before we can make comparisons to what we've lived with centuries ago.
Mhm.
So
Because all this information is new, it's hard to put a pin down. It's hard to pin down absolutely everything.
Which
absolutely.
is why the best thing for us to do in this current time is, if you are not a part of the meta, is to just listen to when, as long as it doesn't conflict with your religion. So, and this is what Minister Ishmael told us last week. He said, we have that the United States has a friend in the Nation of Islam at our homes. So we're not congregating, we're not going out. And another thing we should not be doing is speaking ahead of the
Don't
understandings that
speak
we
out of turn.
have or don't
Uh huh.
have.
Uh huh. Damn,
And
my internet.
and this is all a great for us as a disease, but economic of it as well.
Hmm. Hold on. Before we
Yes.
continue, how do
So
I sound? Am I breaking
I'm
up?
really interested in seeing the of the United States. You are.
I am. It says
Mm-hmm.
my it says my signal is a little stable. Um, damn. All right, how's it now? Is it better?
It's better.
Worse? Better? Okay.
Yes.
Yes.
All right. Okay, we can continue.
So the biggest thing to do, the biggest thing right now, even though we are, of course, heading into our peak, which is why the orders were extended until April 30th, as
Mhm.
of about ago by the current president, for stay at home and social distancing. I can't give him a name. Social distancing. However, that the impact of this is more than the people who are going to die. There are psychological, economic impacts that are going to change the fabric of the entirety of our country. And I definitely think, I know Dr. Jabril probably paid an arm and a leg to go through medical school, but I think they're going to change a lot
Well,
of
I
those
seen the look on your
situations.
face that told the story. Yeesh. I don't even want to imagine how many dollars that is.
I'm one of the blessed ones.
Whew.
But
No, go ahead. Sorry, so sorry.
no. So you're right. So this situation that we are in, this pandemic,
Hmm.
has a lot. I think this tells the story of the importance of understanding science, basic science, number one, because I don't believe this is just my personal belief. I don't believe that we would have ended up in such a terrible predicament had certain precautions been taken early on. But one of the main things that I've become privy to is that the American population isn't as sound in their basic understanding of science as they think. Um,
Basic understanding of a lot of things.
well, that right. So yeah, I hear individuals basing their panic around what they hear media say, what they hear politicians say. But it boils down to lack of understanding of science in general. Social distancing, you're hearing individuals practice good hygiene at a at an optimal capacity at the very moment, something that they should have been practicing ages ago, you're hearing the conversation as far as good hygiene, what's proper good hygiene techniques. That is phenomenal to me. I find it.
So you mean to tell me you all haven't been washing your hands? Pardon me, I said I wasn't going to
Minus
make any jokes, but
my hands.
you haven't been washing your hands up until this point.
I mean, it's phenomenal. The amount of alcoholic concentration needed to properly disinfect. 20 seconds to really out of the hands.
I heard it was 30 seconds.
As somebody who went through the training to just be a nurse's assistant, one of the things that you have to pass is knowing how to wash your hands.
Yeah, I believe.
And I thought that was so weird. I was like, people don't know you're supposed to, and
yeah, you gotta get all up in there. You gotta.
They didn't know that.
Yeah.
It really helps with slowing the spread of transmission, though, which is why there's an emphasis on it currently. People may have known in their mind, but the mindset of the American is so focused on capitalism and consumer that even our daily things that we are supposed to use to exercise and cleanse our body, so that can be anything from, as Muslims, rushing through prayer and even rushing cleansing processes, not reading our scriptures, not studying and things of that nature. So this emphasis is being put on the American public right now, even though we understand ourselves as Muslims. We have to understand that consumerism and capitalism completely take over the ability to govern oneself with discernment and slow processing. So people are literally probably washing their hands by putting soap on it, smacking them together, rubbing them 2 seconds, and washing them so they can go to the next thing. So taking 20 seconds for some people is taking 5. That's why the emphasis is there. Definitely a piece that has to have about, because a lot of people are like, what? I don't know how to wash my hands. I've always been washing my hands, but we'll probably go out and wash your hands after using the bathroom for 2 seconds, put them under some water, and then leave out, because of the mindset that we have is rush and go and go and go and go and go.
That's very true. That's very true.
Yeah.
Guilty.
Definitely, yeah. It's a perspective. It's definitely, it's definitely a way for us to look from the whole and of, well, how don't you know how to do that, or how don't you know this, or how don't you understand this? But that's why we don't speak ahead of what we know. If you say you can wash your hands, but then I ask you how long you're supposed to do it, and if you scratch the middle of your palm in order to get under your nails, or what's the purpose of doing that, and you can't tell me, then you don't know how to wash your hands.
Wow.
And that's basic hygiene.
That's a new one.
Yes.
Wow.
So, Dr. Jabril, do you guys put the soap and move your hand in the middle of your palm?
So, it's funny, as a researcher, I'm gonna be very honest with you. Very few times as a researcher in our lab do I even see my hands, because they're always in gloves. So
let's talk about people wearing gloves and masks.
Oh yeah.
Yes, because stop wearing gloves and masks if you don't know how to take. You are contaminated. I get so frustrated when I see people who don't know how to take a glove off properly. So if you don't know to pinch the ball it up in one hand, 2-finger it from the bottom, and wrap it around itself and throw it away, you are contaminating yourself and other people. If you don't know, you shouldn't go from touching one thing that could be contaminated. Just imagine you had blood on your hands, and this is someone who's worked in the emergency room. So I've worked in the emergency room. I've seen people who've been stabbed, people who have suffered cardiac arrest in Chicago as a volunteer and things of that nature.
Wow.
So I actually work with Dr. Abdullah, if you know him, Dr. Jabril. But so when I go into the emergency room, I put on my full gown. If I go to help the emergency room physician and there's a stab victim and I touch the person and I have blood on my hands, I'm not gonna go and at all. So when we walk around the house, sit in our cars with gloves, then walk into the store with the gloves, and then walk out the store with the
You
gloves.
done contaminated everything. The fruits, the vegetables, the meat, the toilet tissue was going to use.
You have
Sanitizer.
contaminated everything. Exactly. You've contaminated the hand sanitizer. So what is that helping you? And then when you're wearing a mask, and for the average person, we touch our face naturally. I touch my face, and I am working on it, but I touch my face. So you're wearing these contaminated gloves. You touch your face without thinking of it because it's subconscious. Now you've contaminated your face and your mask. So I would recommend to anybody who's going to be using these things, I'm not going to tell you not to use them. I'm going to tell you to use them again with understanding of, one, how to use them, and two, how to take them on and off properly. Because you can't just wear things just to wear them that are PPE, especially when there are medical professionals out here who have no access to PPE, which is personal protective equipment, and they having a bareback going and treating COVID-19 patients.
I've heard about that. Shout out to them. Also, before we continue, Brother Tyreek, he was supposed to be with us tonight, but I made an announcement on my page. He's currently at the hospital working with COVID-19 patients. So may Allah be with him and protect him. That definitely takes a bigger precedence than being on the show. I mean, you got to do what you got to do. So
absolutely.
And that just makes it even more important. Like, to people who may be listening to this, I'm not telling you all, oh my God, you should be panicking, the world is ending, blah, 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 blah. No. But you should take this epidemic seriously. Don't be like some of us black folks saying that, oh, we black, we done suffered through everything, we ain't gonna catch it, we'll be fine. No, don't do that. Don't conspiracy theorize everything with the whole. Now, as far as I'm concerned, all of us here are anti-vax. I don't believe in vaccines. We don't do that. But at the same time, don't what's the word?
Don't stir the pot.
Whole thing to like push that agenda. If you're anti-vax, you're anti-vax. Not everyone's going to be like that, unfortunately, because they don't see the dangers in vaccines and CDC and all of that.
That's an even deeper conversation though, because vaccination or inoculation, it didn't begin with white people. Like we can't attribute things like any medicine that has ever been or created started with us. Exactly.
Yeah.
So inoculation started in the United States because of African slaves. And I can't remember the name off the Onimus, I'm pretty sure, if someone wants to look up. But he told his slave master at the time, he said, well, in Africa, I both have the smallpox and don't have it. And that's because we take a small germ of it and put it in the body, and then the body fights it. And now the body understands when you actually have. Exactly. So the reason why we have in a Nation of Islam decided to be anti-vax and against vaccination is not because we don't understand that. Inshallah, it's not because of that, and I'm sure it's not. But it's because the CDC and other powers that be have taken something that we have been using for years
and
they've corrupted it. Exactly. So they've taken something and changed it into something that now it does affect people who have melanin. Now it does affect people who are young men and who are Black. Now it affects people differently and for specific purposes. So that is an even deeper conversation.
That's a deeper conversation. But my point in bringing that up is like, I get that. But in the midst of this epidemic right now, you can't put your theories together and then classify them as truth, because someone is going to take that truth and get themselves hurt or worse, and that blood will be on your hands. That's why I put this episode together, just for people to have as the basic information or as much as we could provide. And yeah, because it's important. It's very important.
The Honorable Elijah Muhammad, after John F. Kennedy's assassination, told all his ministers not to say anything about it.
Right.
So, I would implore us to think of this situation
just
as
like
very akin to that time, and have the mindset that we don't want to go out and say this is chickens coming home to roost.
We don't want to say that.
We don't want to go out and say that, just because, as Minister Ishmael said, we don't wish and enjoin for the chastisement, because it's not just going to be Christians and bad Jews and white people who get punished. We're going to get punished too, and we're going to suffer too. Even the righteous among us are going to suffer. So, this is a very unprecedented time, and it's for people, again, like you said, not to be nervous or scared that the world's going to end. The world is going to end, but it's not going to end the way we think it's going to end. The world is going to end, and it's going to change in itself, and it's going to be a new paradigm, a new understanding.
100% dissatisfaction brings about 100%.
100% change. You notice that people are like, I'm not paying rent on the 1st because I haven't worked. So that makes no sense for me to pay rent and stuff like that. So, yeah.
Yeah. Even Cheesecake Factory. They said, y'all know damn well we ain't had no customers since when? And you want us to pay rent? Nah.
Funny.
Yeah.
Funny.
But on the real though, I really wanted to put this episode together because I see how serious this is. I'm seeing even believers talking about their relative or their friend up the street or their neighbor, such and such, has either caught or passed away from the coronavirus. This thing, regardless of what we think, whether it's man-made, natural, whatever origin this thing had, the point is, it's here, it's doing damage, and we need to have information out for people to either prevent themselves from catching it or try their best to fight it off as possible.
Yeah. To the point, as far as it being here and fighting, prevention, all of these, it's important to discuss that if you already have an underlying complication, there's really not much you can do at this point other than social distancing and staying home. But this is also why it's very dangerous for the youth, those 30, 40-year-olds that believe that they can go out and just do
Superman,
whatever it is they want to do, is that they become carriers. They become carriers and they come home or go around family and infect them, right? So we all have parents, or grandparents or those that are of age that ultimately 60, 70, 80, their immune system is already somewhat gone through wear and tear. Whether whether the complications exist or not. So those 30, 40-year-olds that believe that, even if I did get it, I would eradicate it, I would eliminate it, you still become a carrier for infecting other people. And that's ultimately what we fear most. Even if you feel like you're part of the category that would get rid of it like that, the incubation period for the virus is 2 weeks.
It'll chill. If it ain't get you, it's going to wait to get somebody else.
Right. Because at that point, a lot of people are unfamiliar with the points of contagion, right, of any virus. And this is where I say, as far as basic science 101, people are.
Dr. Jabril, can you define incubation for our listeners?
Right. So incubation is a term that we use to discuss a virus and or bacteria or germ that grows, has to grow in a specific host condition, a condition that is optimal for the growth of viruses, germs, or pathogens in general, right? Similar to even a newborn baby, right? Incubation in the mother's womb, right? For X amount of time. That is the incubation period, right? So the point is that anything that grows has to have a condition that's optimized for its full development. Viruses have the same, it has the same life cycle, right? That needs incubation in order for that to happen. Early, mid, and full growth, incubation is the necessity for that type of span of growth, right? So 2 weeks is a long time, right? 2 weeks is actually, how can I put this? I'm trying to give a good analogy for this, because the only thing that I could think of that has an incubation of that time period where you don't know that you have it was similar. It would be like herpes, right? So the reality is that the herpes virus, when you catch it or when you contract it,
you're asymptomatic.
You're asymptomatic. You are asymptomatic for the most part. And then there is the incubation period, right? And then all of a sudden there's a trigger. When that trigger occurs, the virus comes out in the area that it was that it was once contracted in, right? So HSV1, the cold sores around the mouth, HSV2 in the genital region, right? This is problematic because if you're asymptomatic for 2 weeks, you will not feel ill. So all of the talk when someone catches the flu or the common cold and say, I know that I'm sick because my throat is scratching. I know that I'm sick because my lymph nodes are swollen. I know that I'm not feeling well, a fever. You won't feel any of that for 2 weeks. 2 weeks. That means that you'll be around people in those 2 weeks, right?
Infecting them.
In fact, you'll be around different age groups within the 2 weeks, infecting them. And the problem is that by the time you do start feeling the symptoms, you won't even know how bad it is for you. How long it would take for you to get rid of the virus yourself.
Because you've had
so that's 2 weeks in addition to
because your body's adapted to it. They think
time whatever. We can't hear you, Soldier. What you said?
I went out. It keeps telling me my internet connection is stable. This will probably be the last time I do video. I'm gonna stick to audio from now on. Can you hear me?
Okay.
Can you all hear me now?
Yes.
Yeah. Now.
Okay. Basically, what I was saying is when you made the point of you don't even know how bad you have it even after those 2 weeks because now it's been sitting there and now your body's used to it. All of a sudden, God forbid, the trigger happens, your body won't know how to respond because it's already been there.
It's been there for a long time. And that's why reports are coming out that it's possible that we were having, around the time of December 2019, it's possible that we were having the coronavirus symptoms when really people thought they were having the flu.
Yep. They thought they were having pneumonia.
Right. And so reports are coming out that, we may be freaking out about it now, but it's dying back in 2019, so-called from the flu. The coronavirus test, the actual, come to find out they were virus positive. They were coronavirus positive, right?
Wow.
So that's how long this virus has been dormant within the air. You could talk about it being and understand why the number drastically rising exponentially by the hour, by the day, by the week, by the month. So it's hard to tell. It's hard to tell what's going to happen on an epidemiological scale. To tell.
Kareem, what was your other question that you have for us?
I think we covered about most of them. Like, I think we pretty much went through the full spectrum of prevention. Stay home, guys. Social distancing. Seriously. Seriously. Stay home. If you don't have to work, if you don't have to get things for survival or whatnot. And by the way, don't be greedy either. Just because this is an epidemic does not give you the excuse to go buck wild. People still have necessary needs: food, toilet
Yes.
paper, sanitation items. Don't be greedy just because this is an epidemic. Please. But
Yes.
stay home. Take care of yourself.
Mhm.
And if they should show symptoms, what's the best way to handle it without going crazy, without giving it to anyone else? Because I personally, I have a roommate,
So,
and God forbid one of
so
us.
the first thing
Mhm,
the first thing you should do is sit down. take take a deep breath.
mhm,
If you're having respiratory issues,
mhm.
then that means that you need to go to intensive care. So that's why I'm saying sit down and take a deep breath. Um, so the reason why we are not going to recommend that you immediately go to the emergency room is because if you don't have it, you can
Now I
get
can
it from
imagine.
someone else who already has it in the emergency room. Yes. So the first thing you should do is one, contact the emergency room if you absolutely cannot breathe or you're having difficulty breathing, and let them know, hey, I'm coming in. These are my symptoms, and this is what's going on. They're going to meet you at the door, gowned up, and then they're going to mask you and they're going to bring you within to the hospital and
Mhm,
they're going to test you.
mhm,
They won't test everyone. So if you are sick and you feel like you're sick, that's why it's best for you to stay home. One, so you can self quarantine and start to feel better. Because, like Dr. Jabril said, it should stay in the upper respiratory and your body should fight it. But if it starts at the lower respiratory and you're unable to breathe, you're unable to get up out of the bed without wheezing and things of that nature, then you need to, at that point, go to the doctor. Um, is there anything you would add, Dr. Jabril?
Um, yeah, so of course reports came out recently that one thing that you should not do is that you shouldn't take ibuprofen.
Yes.
You
wow.
should not take ibuprofen during an acute crisis, such as the lower respiratory infection. And the reason being is that for some apparent reason, we are unsure of the mechanism by which this
What's
occurs.
feeding it?
However,
Mhm,
yeah, ibuprofen symptoms
mhm,
of the coronavirus. It seems to not only exacerbate symptoms, but it seems to virus more virulent. And therefore, the deaths that we are seeing, primarily, this is actually where the report came from in Italy, that a lot of the death that they study-wise were due to patients that were taking ibuprofen.
Yep.
It actually caused this the quickening of the mortality.
Mhm.
So that's something to keep in mind. If you are going through pain, they prefer Tylenol. Um, so that's that. Um, so as far as the immune system is concerned, boosting
mhm,
the immune system,
mhm.
there are many things that one could take. Uh, from the list, vitamin C to zinc, lysine, elderberry, whether you're going the vitamin and mineral approach or the alternative the medical approach as far as herbal supplements, all of them pretty much do the same thing. Echinacea, golden seal, propolis, all of these things
What
enrich.
about like
And
ginger, cayenne pepper, and garlic?
okay, so here's my thing about certain things, right? I would not suggest anything that will cause the body to go into a more like there are certain people that are
Like
sensitive
an
to spicy food.
inflammation.
Right. There are
Yeah.
people that are sensitive to spicy foods, and spicy foods can be correlative to inflammation.
Yep.
I wouldn't suggest anything that will send a person into an adverse effect such as that, right? So the safer things, garlic is safe for the most part, right? Your supplements, your tablets. However, the point is that there are so many things that an individual can take, whether it's alternative as far as the herbal supplements and or vitamin and mineral based, right? That really it's doing the same thing. And this is before we even get into antiviral medication. This is before we even get into vaccination. So just boosting the immune system by those things, right? So on the other hand, from the medical side of it, right, there's reports that are coming out as far as vaccinations, right? There are reports that are coming out as far as antiviral medications, such as anti-malarial drugs, hydroxychloroquine, lupus drugs. There are
even
reports,
HIV drugs,
even
right?
HIV drugs, although they kind of, stepped away from that per se. They're still put more. Um, they are at this moment, they're looking into treating people that are infected with previously infected patients that had overcome the virus, so using their plasma blood as a means to fight off the infections in other people. It's an old technique that was done before in the 50s, before we got into antiviral medication and before we got into vaccination. So back in the 50s, it was an old technique where those that overcame a virus or a pathogen, the antibodies were already in the blood, right? So they would utilize that blood once compatible with the individual's MHC complex. They would give it to the patient, and that will lend immunity for them, right? It's a temporary thing. It wouldn't give that person longevity as far as immunity. However, it would fight off the virus at that moment in time, right? So they're going back to that technique. So that just goes to show you how desperate countries are in trying to fight what's really going on, right? So even right now, they're talking about combination drugs of antiviral medication and antibacterial. So they're mixing hydroxychloroquine with the Z-Pak, azithromycin, right? So from the medical side of things, they're trying their best to combat whoever is admitted into the ICU or the ER as much as possible. And for those at home, you can utilize herbal supplements and or vitamins and minerals to do the same thing, right? And as Sister Tynetta said, if the virus seems to have exacerbated into a lower respiratory tract infection where you can't breathe and you're going into acute acute arrest as far as breathing, then you may want to, admit yourself into the hospital. But if it stays upper respiratory, you're talking about the fever, the raging fever. Say that again.
You're basically saying stay home and self-quarantine if it remains upper respiratory.
Right. So, of course, if the fever breaks over 102, 103, you want to take something that's going to help reduce it. When the body gets into a longevity or a lengthened period of time being in a fever type of situation, you become dehydrated and people can die from fevers. So it's important to keep an eye on if you do have a fever to break over a certain number. You want to stay hydrated. You want to stay well rested. You want to make sure that the immune system is as optimal as it can be. Exactly like I said, with the vitamins, minerals, herbal supplements, whatever the case, even your food. So, we can dive into not ingesting food that are mucus producing.
Like milk,
so
and
you want to
cheese.
Right, you want to stay away from milk and cheese. You want to stay away from any food that's going to cause an inflammatory response. So you primarily want to stick with food such as soup of sorts. You want to stick with foods that's going to break down mucus and make sure that the nasal pathway and the nasal congestion is pretty much clear, right? So you want to make sure you aid the body in in those ways. What else? There's so, believe it or not, everything that I'm saying is would do even in the flu. It's what you do in a flu type situation. Now, I've contracted the flu before. Not many people know what a flu feels like, right? that kind of makes it even more interesting because they don't know they have is similar to allergies, is it similar to a bad cold, is it similar to a flu that they may never had, and it's difficult because we're in flu season.
Yeah.
This is the season primarily where people get sick.
I just got over
right.
pneumonia.
So the interesting part about it is that the symptoms over, and it's making people concerned that they don't understand which classification it falls under. Am I suffering a severe allergy attack? Am I suffering a severe cold, suffering from a severe flu, XYZ? So the point is that everything that we're upper respiratory tract infection should be as an individual would of those things. Maybe, right? Because allergies, you can take anti-allergy medicines to stop mucus and the allergens or the reaction, right? Thing else, yeah. Hydration, immune, vitamin. In fact, there's a lot of hospitals right now that are patients with vitamin C, like vitamin C right now in hospitals. So, the biggest thing is for individuals to remain calm, because really the panic will send someone into a greater sense of adverse effects, right? And I'm gonna give you an example. The couple in Arizona, the husband of a couple that died in Arizona, right? He died because he took what was supposed to be similar to hydroxychloroquine. He wound up taking tablets of chloroquine, which was used to clean fish tanks, the aquarium, right? So in him he wound up passing, sad to hear. And with that being said, fusion of chloroquine and clean fish tanks was confused with hydroxychloroquine, which is the anti-loop anti-malarial drug, right? So what panic does, it does to average individuals that are not in the know and they have no base of information.
Yeah. Woman out of Italy, I think she committed suicide when she got COVID-19. A fear of other patients.
Death.
Right.
So she was gonna give the disease to other people herself. Yeah. So you have to stay calm. You really have to in a state of extreme alertness, and understand this is a process and we just comes.
Yeah.
Well, we've reached our hour. I want to go into these two questions that were asked, although I think they were pretty much covered, and then we'll wrap things up. One question was from a sister, and these are anonymous, by the way. Can you all hear me? You all can hear me? I mean, I know I'm probably a little choppy. Well, less a question, more of a statement. The sister asked, help convince my parents to take better precautions since they're retail workers. Now, I still go to work. I do security, but the place I work at was closed and shut down because of the outbreak. So I'm really not securing anything except buildings. But what about those that still work at the Walmarts, the Targets, the places that need to be open up to necessity?
It's really interesting to help. There's convincing in the world. If someone doesn't want to take proper precautions, take them. Right. What we can as one pre-professional and as somebody who is healthcare, Dr. Jabril, we can do is just let you. This is not a drill. Not evolution is being, and we're going through it currently. The best thing for them at work request as a they be given things and potentially mass. Currently, in California, retailers, especially those who work at grocery, classified as workers, because they are, in terms of helping people get access to water and other necessary resources.
Mm.
So they should treat themselves as a healthcare worker with and they're working, and that's hand whenever possible. You don't want to utilizer all. Go wash your hands. Go wash. Wearing them correctly, but wearing it correctly. So keeping in mind the social, because not everyone can. Um, but there's no if the sheer amount of lying right now convince you, you're not going to. In Iran, right, almost 3,000 in Iran. Yeah, so China and Iran and the United States, top countries in terms of deaths, and I think Spain too. But numbers, and you don't want to make proper. We can only lead. We can't make you drink. You have to decide to protect yourself. And just a lot of people are saying this is a part of that process, set up to the higher powers, and not just Christian, but
Muslim too.
many other denominations of faith. And we have to really see our scripture. So Prophet Muhammad, peace be upon him, said in a hadith, to a man who had a horse, he said, I'm not going to tie my horse up because I believe in Allah. And Prophet Muhammad said, tie and then believe in Allah afterwards. So we have to understand that understand, like, we have the power and the ability to protect ourselves with our mind that is given to us and our free will. So ain't no convincing.
Right. I second what was talking about. I mean, the reality is that I'm convincing. Yeah, I feel it's something that Black community I find very like don't believe it if they don't.
Mm-hmm.
And with that type of mentality, that means what? I have to see someone with the virus, I have to see someone die, someone close to you. That's unfortunate. This day and age, it's almost as if we have such a distrust for politics and to our own dismay, and we see it with our eye. We're not going to take precautions because we don't believe. That makes zero sense to me. Because is that we don't see viruses either, right? But we know the flu. We know the virus that we have come with and contracted, whether it was this Ebola, whatever the case may have been, whatever pathogen you want to name, you could not see it with your naked eye. So that doesn't exist. You're not going to believe it, right? Mm-hmm. So that's kind of why I'm done with the whole convincing aspect, because at a certain point, you have to come face to face with reality, right? Come face to face with that. And there is no amount of wisdom or knowledge that a healthcare or someone that is in could give a person, make them want to take care of precautions of concern.
So at the end of the day, you can lead a horse to water, but you can't make him drink.
I told someone, I put it on my Instagram, as members of speaking and saying that the coronavirus or COVID-19 doesn't exist, we are directly calling the minister a liar, because the minister shut down the mosque, him and the executive council, and also told us not to do cheek to cheek or to observe social distancing.
Everybody hits these.
Yes. So if you're letting that come out of your mouth, and you say you are a believer in Master Muhammad, the Honorable Elijah Muhammad, the minister as our divine warner and guider, you are not listening to your guidance. So at what point do me, little Tynetta, tell you when you won't even listen to your leader, teacher, and guide? So I have nothing to say to you. I'm just going to, as Dr. Jabril said, let you come face to face with your mortality, and that'll be the time.
Unfortunately.
So,
I'm glad you said that. The last question is that, have you seen any propaganda from media / uninformed individuals? If so, what are they? And I know that's pretty loaded. I feel like you covered a little bit, but if you want to, your face, you tell us the story.
Oh man,
that's shady. Hold on, it got real dark.
Yeah, I felt like those are eclipse. That was an eclipse.
Okay, so I'm not going to.
You're not going to stand on names.
You can't feed. We're not going to feed this virus of called propaganda. So to those who are propagandists, what I'm going to tell you on this show is, in the most beautiful, nicest way, don't speak. Just, if you have nothing that has been confirmed and processed and disseminated in a correct and scientific way, just don't talk. Because you don't have to talk.
You're too nice. Shut up.
Yes.
Shut up. You're not a medical professional. Shut up. If you have no degrees anywhere in the doctoral field, if you're not a nurse, you're not a doctor, you're not a pre-med student, you don't even know basic, shut up. Shut up. That's what I'm saying. I don't believe I don't believe in being like, we don't filter on this show. If you watched all the past other episodes, you'll know there's no filter on this show. If you're nowhere in the medical field, you're not even in the spectrum. You have no doctor in your name, or that doctor is in your name and it's not legit, shut up.
And I would also say, to those who feel like they need to speak, find an opportunity to assist the community first. So if you feel like, I need to say something about this, like this is, say more with your actions than you. Who is not helping the elderly, who's not donating out of and you're retired, who is not assisting people by disseminating information for their rent, utilities, for them to pay bills, then you are just speaking. You're just talking, and that's just highly unnecessary. So we don't just move with, oh yeah, this is what I think is going on in my mind. I have concocted this idea. And if anyone has ever retired, you can understand why people, particularly Black people, are like to the medical industry. However, we have to see things with an eye of discernment. And even if we don't trust them, even if we don't trust the medical system and things that they do, we do have to understand that there are things in place for us to assist and amplify those who are in trouble, instead of just being on one end of the spectrum.
Take what you need.
Right now, we don't have time for negativity. Yeah, we don't have time for negativity. So
point. Say that again.
I was gonna say, finish us out, Doc. Go ahead.
Yeah. as a scientist, I feel that part of this discussion going as far as how it let the scientists, we're discussing that at the moment. There's a lot of articles that are coming that feel as if nature did it. A lot of articles that are coming out to feel as if it's man-made. Let those fish it out. Let us sift it.
Guys, did it cut off on your side? Guys, can you hear me?
It doesn't stop those that are dying. If you're going to engage in conversation, if you're going to engage in the dissemination of propaganda, find yourself doing something, because at the end of the day, propaganda is how to boost the immune system. Yep. I think that isn't propaganda. We all know what we should and shouldn't be doing, right? What also isn't propaganda? The means or the importance of distancing yourself or self-quarantine. I think we all understand the importance of that. As far as anything else is concerned, it doesn't lend to the mitigation of the pandemic that we are suffering. Yep. It doesn't lend to solving the issue. It only perpetuates the idea that someone's behind it and I need to find out who's behind it so I can stop the situation. No, you quote unquote finding out who's behind it isn't going to stop anything. Nope. Trust me.
At all.
It's not going to stop anything.
It's not stopping nothing.
At the end of the day, and I'm going to just take words from what Minister Ishmael said today that he got from the Honorable Minister Louis Farrakhan. At the end of the day, God's hand is in it anyway. Yep. God has allowed this to happen for a reason. So until that reason is revealed to us, we just need to keep doing what we've been doing. Self-quarantine if you're sick. If you're not sick, social distance yourself. And if it's critical, see a doctor. If it's not critical, don't put yourself out there because now you're vulnerable. But I don't know what happened. It cut off on me briefly. I didn't catch everything that you said, but I'm sure it was recorded. It was a pleasure having the both of you on the show. I wish Tariq would have been here. I'm sure he would have enjoyed this as well. He's here with us in spirit. Thank you guys for coming.
Yeah.
Thank you, beloved, and look forward to talking with you again.
Yes. Nice to meet you, Dr. Jabril.
Tynetta, it's a pleasure.
Yes. Assalamu alaikum.
Walaikum salam, everybody. This has been another episode of Kareem Talks. I'm Kareem. That's the doctor. That's the student. I'm the host, and it's a wrap. Later. All right. Meeting.